Welcome to our series of the future of Emory Healthcare and Woodruff Health Sciences. Tammie, thank you for joining me. How would you categorize perhaps some of the changes we've made in the last 7 months?
Transformational, I think I would say. The ability for our patients to get in and be seen today or tomorrow has been incredible, not the least of which both my husband and son were absolutely thrilled when they could get in today or tomorrow when they called for an appointment.
Oh, great.
And loved being able to change their appointments via FastPass when they didn't like the ones that they were given.
Yeah.
Patients and families are benefiting, and I think that our best years are yet to come.
Well, I hope so. Emory did a fantastic job during the pandemic in terms of responding and vaccinating and leading with new therapies and new treatments and testing. That same muscle of change, we're asking sort of the organization to change again. Help me to understand during times of change, how do people handle that change?
I've had a lot of time to reflect some of the things that we learned during the pandemic and the rapidity of change that was required. So I think that the number one thing is courage. We didn't know what was going on. We didn't know what this virus was. We didn't know what was happening. Our whole world was rocked. And yet we had courage, and we got in our cars and drove to the hospital and took care of patients, and people did that. I think so. Courage is one. The number two thing, I think, aside from courage, is trust. We have to trust that people have our best interests at heart, and that we can trust the system to act on our behalf. And that's a really big piece of, after you're courageous, having that trust in an organization is key.
How, as leaders, and obviously you're one of them, do we engender that trust?
Yep. So I think that trust really has a number of aspects, but number one is competency. I think being able to have competency in our leadership is number one. Number two is going to be transparency. Being able to really discuss what's happening, even if we don't know the why it's happening. So I think when we look at competency and transparency as part of trust, I think are fundamental. And then I think vulnerability is one. So vulnerability in leaders, to be able to say, I'm sorry, to be able to say, we can do it differently next time, the ability to say, it's not going exactly the way that I'd like for it to go. I think those are really three key things that we need going forward.
But what do we do when we're having trouble managing the change? What do we tell the people that work here, that trust us?
We talk a lot about delayed gratification in our own lives.
Right.
Many of us have...
Hard for me to teach my children
Exactly, right? So thinking about the timetable, one of the things that I taught my kids and somebody taught me was really not ever making a decision while you're hungry, sad, tired, lonely, or angry. I like to think about giving yourself increments, 3 months, 6 months, 1 year, 3 years, 5 years, to be able to absorb the change. That we shouldn't make any decisions while we're in any of those emotional states, and we need to look on the horizon, and that we're on the macro, the big level, as opposed to looking 6 inches from where the change is. We might want to go 1 foot and then maybe a yard, and then kind of keep going that way.
Yeah, you've given us a number of points, right, to handle change. Help us with the loneliness part. We are a family, and making sure that you've always reminded me, right, we have each other. Right. We have each other's backs, and maybe you can help us, remind us about that.
Yeah. Isolation. We can be in an organization with 30,000 people and feel alone. The Zoom world has a place. And I also think that place can lead to some loneliness. So I think that us being able to have human interaction is fundamental. And so those of us who have the joy of being able to come into the hospital and being able to see others and touch others and interact with others, I think is really important. It's so much easier to be angry afar.
Yes.
And so when we get into human relationship and contact with people, we're much more likely to be able to support one another with not just our verbal communication, but our nonverbal communication. So I'm going to say that abandoning the Zoom world when it's needed is really important to combat loneliness. The other one is to pick up the phone. So when you are struggling or I'm struggling, I am going to pick up the phone and call somebody. I'm not going to write an email. I'm not going to post on social media. I'm not going to do any of those things. I'm going to pick up the phone. I'm going to call a trusted colleague. I'm going to call another leader. I'm going to call you, and I'm going to talk about what's bothering me so that I can get the support that I need. Really being able to talk to people, I think, is really central.
So I wanted to thank you for speaking with me about the future of Emory Healthcare and Woodruff Health Sciences. So thank you.
Yeah. Thanks, Ravi, for courage, leadership, competency, and trust. I appreciate it.
And I'm not lonely because you're on my speed dial.
Anti-loneliness.
Thank you.